Thank you very much, Mr. Tsai, for being here with us. You have an incredibly important portfolio that you oversee. 1 in 4 Americans in your care. On April 22nd, as we all know, the administration finalized the policy to require states to spend 80% of Medicaid payments for home care services on compensation for workers. I'm glad the administration has taken the steps that they've taken. There are many groups that support the policy. Opponents of the policy argue that 20% of payments isn't enough to cover administrative costs. So I want to give you the opportunity to tell us why you chose this approach to improve the HCBS workforce. Why is the 80-20 proposal so important? And what do you have to say to the opponents?
Thank you to the ranking member for that question and your support for home care HCBS services. We, as part of making sure people can have access to quality care, we need to make sure that there is a sufficient workforce available, which requires a sufficient funding for the workforce, and importantly, for one of the reasons why we finalized this rule is to make sure that Medicaid payments for direct care, for home and community-based services, should go to direct care workers versus administrative overhead and profit. And we did have very clear data points that pointed us to the 80%. And in addition, the American Rescue Plan, which I thank Congress for as well, and those investments, that $37 billion, the vast majority of states that, every state utilized that funding, the vast majority, almost to a T, used that on workforce, and many of them, as they made investments in workforce, also had requirements that a sufficient portion of those investments would go to the direct care workforce. So we are seeing that, that interest and appetite and policy direction from states across the continuum as well.
Mm-hmm. I would note that the Republican Study Committee, which my understanding is they represent a majority of the Republican conference, released its budget for fiscal year 25. That budget endorses gutting funding for federal health care programs by $4.5 trillion, including the Affordable Care Act, the Children's Health Insurance Program, and of course, Medicaid. What would that do? What would the ground look like if that were to be the case? And what does the president propose in his budget to strengthen Medicaid?
Appreciate that question, and I haven't seen the study committee's report, so I can't comment on that. But relative to the impact of any large budget cuts for the Medicaid and Children's Health Insurance Program, it would be devastating for the health and mortality and morbidity for kids, adults, individuals with disabilities, others all across the country.
Yeah, we're not talking about systems that are rich systems to begin with, and I think that it's very important to have balanced policies. We can't afford to do without nursing homes in our country. In rural areas, the stress is even greater. But I don't think we're going to attract and keep a workforce unless they can live on what they make. And so in your considerations, did you have like 10 or 20 options that you examined and then landed on this one, taking all of these things into consideration? Because there's a real bone of contention here, obviously. You could hear it in the chairman's opening statement and then in mine and the others.
I appreciate that. I would say one really important thing to emphasize is in part of supporting stronger access to home and community-based services, the rule hit on many different pieces. The 80-20 was only one piece. There were many other provisions, from quality to transparency of rates to wait lists, which Chair Rogers discussed. And so it is a multifaceted, systematic way of getting at how do we make home care stronger and more accessible And we also think that investments are really important down payments. And you asked about the president's commitment. The president's budget includes a proposal for $150 billion investment into home and community-based services.
Well, my time has expired, and I thank you for being here today and the such important work that you do day in and day out. Yield back, Mr. Chair.